Hello! Welcome to the presentation, Introduction to Health Information Systems. In this presentation, we will introduce the concept of Health Information System. The author of the presentation is Javier Esparza, and this is a virtual avatar, automatically generated for guiding you throughout this presentation contents. In the next slides, we will begin introducing the concept of Health Information System, a very important tool for managing population health. A health information system is the result of integrating multiple subsystems. So we will introduce the most popular application integration techniques today. What are health information systems? In short, a health information system is a system which manages health data. This includes collecting, processing, reporting, and properly analyzing the health data. The health data may be obtained from multiple sources, which must be carefully selected in order to guarantee their usefulness and quality. These data are combined to generate very valuable information. This information is essential for making well-informed healthcare policy decisions. Health information systems can be used by everyone in healthcare, from patients to clinicians to public health officials. All of them will obtain benefits. As stated in a report of the World Health Organization in 2008, better information means better decision-making, leading to better health. Health information systems are important because they help to manage the overall population health. Because they have access to all relevant information, they are able to identify trends and potential alerts, like for example emergent diseases or other acute health threats, like a pandemic. As they aggregate data from multiple patients, they help to diagnose individual patients and to treat them with appropriate techniques. In this sense, they may act as a very valuable supporting tool for the medical professionals. The health data coming from different healthcare providers allow to implement collaborative care. In this way, complementary treatments may be applied or contraindications may be easily detected. Finally, they keep track of the available resources and the real needs, and they allow to optimize their assignment, resulting in reduced healthcare costs. Furthermore, the mere fact of digitizing and exchanging health data through digital networks implies significant cost savings. Think, for example, on the benefits of using electronic health records in a hospital instead of using paper-based histories. The data used by a health information system comes from very varied sources. The data may be clinical, for example, the electronic health records obtained from a hospital, or non-clinical, for example, data obtained from a social network. Data may be obtained continuously, for example, from a wearable device used by a patient, or periodically, for example, as the result of a process importing data from a remote database. It is common to classify the data sources as either population-based or institution-based. Population-based data sources include all data coming from the individuals within a given population. For example, data coming from the census, the civil registration, population surveys, social networks, wearable devices, etc. Institution-based data sources include all data generated as the result of an administrative or operational activity. These data may be medical, for example, the morbidity and mortality among people using the health services, or non-medical, like for example data about accidents or violent deaths, or human, financial, and logistic information. With so many data sources, the amount of data to process is typically so huge that big data techniques are commonly applied in order to obtain insight from the data. But this matter will be the subject of another course. A health information system is not a monolithic creature. Instead, all the required data sources are usually fragmented into different subsystems, usually geographically distributed. Some of these subsystems may run in-house, in on-premises data centers. Others may run on remote cloud infrastructures, in order to guarantee appropriate capacity, performance, and reliability. This matter will be introduced in another course. Anyway, a health information system is the result of a joint integration effort of all these subsystems. Therefore, the key term here is application integration. Application integration is a term applied when independent applications work together. This typically means sharing or exchanging data through different means. The most common integration techniques are through a shared database, using service-oriented architectures, or using message-oriented architectures. We will briefly explore these techniques in the following minutes. A natural way of making different applications work together by sharing data involves accessing a common data store. It is a simple, direct approach and does not need additional software layers or intermediaries. The data are centralized in a single place, which is the unique source of truth, and any application can obtain up-to-date information instantly. This centralization simplifies data management and maintenance. Today, it is common to classify the data stores in two broad categories: relational or SQL stores and NoSQL stores. The SQL stores have dominated the market for decades and provide very strong guarantees, called ACID, which is an acronym representing the properties of atomicity, consistency, isolation, and durability. These guarantees involve non-negligible cost and are not scalable. When the system load or the data volume grows considerably, the store performance degrades significantly. Today, most applications do not require so many guarantees, but they need to work with big data volumes or at high speeds. NoSQL systems arise to cover this need. They are stores which relax ACID properties in favor of performance, scalability, and availability. They are said to implement a weak consistency model called BASE, which stands for the properties of basically available, soft state, and eventually consistent. Even though using shared databases is a very natural approach for sharing data between applications, it presents important drawbacks. On the one hand, the database schema must cover the needs of all the applications, and therefore it must be either too generic or too complex. When the number of dependent applications grows, the interdependencies between data becomes very complex. In this way, the database presents a single point of very high coupling between the applications. This means updating the applications and creating new versions is going to be something really difficult, since extending or modifying the database schema is almost impossible. On the other hand, if the workload increases, the database might become a bottleneck of the system. Furthermore, it is clearly a single point of failure. If the database crashes, the whole system fails. A different approach for integrating applications involves encapsulating the different subsystems in autonomous units called services. A service is a self-governed entity, which includes all required resources, even its own storage, and evolves in an independent manner. A service publishes a subset of well-defined capabilities through a stable interface called contract. The contract not only describes the provided capabilities, but also the protocols and standards required to reach them, and even quality of service properties, like the expected maximum response time. To guarantee maximum interoperability between services, they typically communicate using standard technologies. Some examples are SOAP or REST web services. This approach induces architectures with low coupling, which means less dependencies, and thus favor easy evolution of the different parts. Also, in such a distributed scenario, no bottlenecks or single points of failure exist. Traditional service-oriented architectures make use of synchronous communications. This means a consumer sends a request to a provider, then the provider executes the requested capability and finally returns a result. In this scenario, the consumer gets blocked until it receives a response from the provider. If the provider or the network is slow or busy, the consumer will experience significant delays. Also, synchronous communications force the consumer to know the location where the provider is listening for incoming requests. Thus, moving the provider to a new location is going to be a difficult task. This constraint is called spatial coupling. Finally, to enable the communication, both the consumer and the provider must be running at the same time. If any of them fails, communication is not possible. This is called temporal coupling. To avoid the problems caused by the synchronous nature of service-oriented architectures, a new element gets introduced in message-oriented architectures. It is the messaging system, also called message broker, message queue, or enterprise service bus. In this new scenario, services do not communicate directly, but through an intermediary instead. The intermediary is specialized in routing messages in a reliable way and may have a monolithic or distributed architecture. In this context, the communications against the messaging system are typically asynchronous. This means the consumer sends a message to the message broker and continues working, so the consumer does not get blocked waiting for a response. This approach has numerous advantages. On the one hand, the consumer will have an overall better performance, since delays due to communications disappear. On the other hand, the consumers do not depend anymore on the location or availability of the provider. They only depend on the availability of the message broker. This means consumers and providers are temporarily and spatially uncoupled. Finally, the resilience of the solution increases because both consumers and providers may fail, and the message broker will make reattempts until messages can be delivered. Message-oriented architectures are not perfect though. On the one hand, asynchronous systems are very difficult to manage and to debug. Also, some parts of the system are not eligible for using asynchronous communications at all. On the other hand, as all communications go through the message broker, it becomes a single point of failure. To avoid this situation, it is necessary to enable replication and recovery strategies in the broker, which adds additional complexity to the solution. To conclude with, health information systems help to manage population health by integrating data and processing from very varied subsystems. This integration may be achieved using different strategies and techniques, each one with its own advantages and disadvantages. Thank you for your attention.